Just last year, Serena Williams had her first baby, and her birth experience became life-threatening after her nursing team and physicians did not respond to her initial concerns about her history of pulmonary embolism. She had to insist that they give her proper tests and treatment before they realized she was right about her shortness of breath. And what could have been a minor intervention at an earlier stage turned into 6 weeks of having to be bedridden as a new mother. Hers was not a case of class bias or a lack of health literacy in terms of reasons why her concerns were not initially considered accurate or valid. We must ask ourselves if we can continue to afford not engaging with how the racialized imagination may still be informing our health practices in light of the fact that a natural outgrowth and fruit is disparate treatment of the ones in our care. That the racialized imagination gives rise to inaccuracy, suboptimal care, and dangerous health outcomes should certainly give us pause as Christian health professionals, knowing that our Lord, the great physician, charges us to treat our neighbors as we ourselves would desire to be treated.